Today I want to talk about a very important condition, osteoporosis. Osteoporosis is a common disease that is characterized by low bone mass. So basically it is low bone mass. Microarchitectural disruption happens, skeletal fragility happens, and it results in increased risk of fractures. So the goal of screening is to identify osteoporosis in persons who are at high risk for developing sustained fractures. So you need to identify them. Screening for fracture involves you take history, you do physical examination, and then you do standard testing, CBC, CMP, and finally the measurement of bone mineral density. The clinical history should include inquiring about possible secondary causes of bone loss, such as use of medications with potential adverse effects on bone health and family history of osteoporosis. DEXA is the most widely used method for measuring BMD because it gives very precise measurements at clinically relevant skeletal sites. So the major disadvantage of DEXA is its cost. It's an expensive test and it uses ionizing radiation. So BMD assessment should be done in all women over 65 years of age. So when you assess BMD, especially in post-menopausal women, if there are risk factors, you need to take the risk factors into consideration, like advanced age, or if the person has previous fracture, or the person has been taking glucocorticoids for long-term treatments like rheumatoid arthritis, people with low body weight, or family history of fractures, or cigarette smoking, or excessive alcohol intake. So when you see these risk factors, you need to be more careful to evaluate for osteoporosis. So when you do this, you identify which patient has the problem. You don't have to do this in all men, but even in men, if they have low bone mass, or if they have osteopenia, if they have a risk of high fractures, history of fractures, or if they are losing height, or if they have long-term glucocorticoid therapy or androgen deprivation therapy, like for example prostate cancer patients, or hypogonadism, primary hyperparathyroidism, or hyperthyroidism. So those are the disorders. For example, if the men have those disorders, you need to assess their bone mass. Then for screening BMD, you do dual energy X-ray absorptiometry, that is DEXA, over peripheral measurements. So sometimes we do peripheral measurements. That is fine because they are more affordable. But for screening of hip and spine, it's better to do a DEXA scan. And especially in older individuals, it is more useful. So you repeat BMD measurements in people who have this bone loss, in women and men with low bone mass, like T-score -2 to -2.49. And if they have risk factors like glucocorticoid use or hyperparathyroidism, then you need to assess them every 2 years. You need to scan every 2 years because they have so many risk factors. And in women 65 years of age and older, and they have a T-score like -1.5 to -1.99, and they have no risk factors, then you can extend the DEXA scan, like let us say like every 3 to 5 years. in women 65 years of age and older, and their T-score is like minus 1.01 to minus 1.49, and they don't have any risk factors, then you can extend the interval much longer, like doing DEXA like every 10 to 15 years. So you see, everything depends on the risk factors and the T-score. If the T-score is high, go ahead. If they have high risk factors, you need to take more and more care for these patients. So those are the most important points in osteoporosis. So you need to take a good history, do a physical examination. If there are risk factors, you need to go for DEXA scan and measure the T-score, and based on the T-score and the risk factors, you need to contemplate the future course and also the treatment of osteoporosis. I hope those few points would help you to extent. Thank you very much.